Hi, my name is Jerry Hesch. I'm a physical therapist and a manual therapist that practices in Henderson, Nevada. I am the founder of the Hesch Institute, and this is a very brief video showing a false negative spring test of inferior glide to the right ilium. This is my contact information. We teach seminars next month, September. I will have a couple of clinicians fly in from New York and Arizona to do some one-on-one tutorials. We also have a distance learning program, and we do have seminars that we teach, and we also have a clinical practice. So here's some additional information. I work part-time only, and this is a client who, after several years of frustration, has come to see me for evaluation and diagnosis of complex sacroiliac joint dysfunction, and we anticipate filming her as a case study. My purpose today is to show how easy it is to do an improper spring test and say, oh, that's okay, that's moving, that looks normal. Truth is, we have to slow it down just a little bit to do it properly. This is a client who has hypermobility syndrome. Today's the first day someone has told her that. Just out of curiosity, and we'll film this later on, her subtalar joints are actually stuck on both sides. There's no rotation, and there's no varus or valgus available. I mean, if there is, we're talking less than 5 degrees. Rest of her body is distinctly hypermobile. She has the gunstock deformity in the elbow. I can hyperextend her fifth digit 90 degrees. Over pressure, I can take it a little bit further. Her case is absolutely fascinating, but for our purpose, we are only going to focus on the spring test of her right ilium. When she was supine, I was able to take up the slack on the left side, and then I was able to rotate it at a 45-degree angle, and it would move further, and it would recoil back. You really can't measure force in pounds, but let's pretend we can. We're not going to convert to Newton meters, which would be the proper way. But basically, if you put your hand on a scale and you measure 20 pounds of force, 15 to 20 is the approximate amount of force we use to take up the slack on the left ilium, and then we imparted a additional 15 to 20 to create that movement. And the movement was present on the left, and it did recoil back. So I think we're going to go ahead and demonstrate that. Let's have you lie on your back, please. On the left side, and the palpatory landmarks are consistent. The right ilium is more anterior and inferior. The right iliac anterior shelf is lower. On the left side, when I take up the slack, I come to an end point. I'm at that first end point now. And now with my right hand on her left ilium, I can create some spring, and you can see the recoil. Okay? So spring, recoil, spring, recoil, spring, recoil, and now I let go and it bounces back. On the right side, I'm putting 20 pounds of force, I'm putting 30, I'm putting 40, I can't move it at all. Now, lie on your stomach, please. To validate that she has a right anterior ilium, the right ilium being rotated anteriorly, and truth be told, I really think it's a bilateral pattern of the pelvis. I don't think it really is rotation happening of the ilium and the sacrum, but semantically we're going to call it a right anterior ilium. If the right side is rotated, or if the entire pelvis is positioned such that it looks like the right ilium is rotated, then it will not spring inferiorly. Now, I did a cursory spring test with her, and it was improper, and I just came here and I did that. And one could say, oh yes, look, the force translates through the whole body. That is not a spring test. This is not a spring test according to the Hesch method. We call our spring test double recoil spring test, or springing with awareness. Now, the proper way to do it is to take up the slack to a distinct endpoint. And you can see that whole lower extremity moves, and it comes to an endpoint. I have about 15 to 20 pounds of force, I'll have to translate that sometime so I can actually speak in terms of Newton meters, because pounds is not really a force. But you can practice on a bathroom scale, and you can certainly approximate. Nice study was done by Matthias Bach et al. Many years ago. So now that I've taken up the slack, now when I try and spring it, I'm putting the same amount of force. I'm putting an additional 20 and nothing is happening. So there is no spring. On the left side, when I take up the slack, okay, you can see the body stop. You can see the movement go through the body. And now when I spring it, it moves again. It moves further. And it recoils into my hand, and now I let go. So the point being, you have to slow it down. If you do a quick thrust, that does not give you useful information. When you take up the slack, you come to an end point, okay? And then you perform the spring test, and I cannot make it move. I'm using approximately 15 to 20 pounds of force, and there is no movement. So the whole point of this brief demonstration is to show that the spring testing is very specific, and the springing with awareness technique is very specific, and that you really have to slow it down to do it properly. And you'll see some videos on YouTube and such in which there's springing on the spine, or on the ribs, or on the sacrum, or on the ilium, and it really does not have the ability to give you the kind of information you will get when you really slow it down. I happen to be springing her sacrum, and you take up the slack. It takes about 1 second, maybe 1.5, and then you do a thrust, and you feel the recoil, okay? And based on this test, I would say that her sacrum does in fact spring forward, and it recoils backward, and now I let go of that force. Whereas if I just did a quick spring test, it's really, the force is really dissipated throughout the body. Whereas when you take up the slack, you really are in fact, coning in the forces to at least this region, okay? I sincerely doubt that you can absolutely, completely block out nearby segments. I sincerely believe that injuries do not happen one joint at a time. I sincerely believe that if one joint is stuck and doesn't move per my testing, I sincerely believe that the one above and below are also a little bit restricted in their motion, and yet the primary treatment at the stuck joint might release motion above and below. I think that in time we'll have more information on that with some studies, but I want to conclude right now. Point being, you've got to slow it down when you do a spring test, if you want to call it springing with awareness. Thank you very much.